Chest infection? Have you ever had a cough that just won't go away? Maybe you're coughing up mucus, feeling unusually tired, or getting short of breath walking up the stairs. You might think it's just a cold. But sometimes these symptoms can signal something more serious, a chest infection. And the important question is, how do you know when a cough is more than just a cough? In this video, we'll explain the warning signs of a chest infection, what causes it, how doctors diagnose it, treatment options, and when you should seek urgent medical care. Chest infection? 7 warning signs. What is a chest infection? A chest infection is an infection affecting the airways or lungs. It can involve the larger airways, which doctors may call bronchitis, or it can affect the deeper lung tissue, causing pneumonia. Chest infections can be caused by viruses, bacteria, and less commonly, other organisms. And not every chest infection needs antibiotics. That distinction is extremely important. Warning sign number 1. A persistent Q. Warning sign number 1. A persistent or worsening cough. A cough is one of the most common symptoms of respiratory infections. You may have a dry cough, or you may produce mucus. The color of mucus alone, however, does not reliably tell you whether an infection is bacterial. If your cough is getting worse instead of better, or continues longer than expected, it's worth talking with a healthcare professional. Warning sign number 2. Phlegm or mucus. Warning sign number 2. Increased mucus or phlegm. When your airways become irritated or inflamed, your symptoms, examination, medical history, and sometimes testing are much more important. Warning sign number 3. Shortness of breath. Warning sign number 3. Shortness of breath. If you suddenly find it harder to breathe during normal activities, don't simply assume you're out of shape. A significant chest infection can interfere with normal breathing. Pay particular attention if shortness of breath is new, worsening, or happening even while you're resting. Warning sign number 4. Fever and chills. Warning sign number 4. Fever, chills, or feeling unusually cold and shaky. Fever can occur when your immune system responds to an infection. You may also experience sweating, weakness, headache, or body aches. However, the absence of fever does not completely rule out a chest infection, especially in older adults or people with certain medical conditions. Warning sign number 5. Chest pain. Warning sign number 5. Chest discomfort or pain. Some people with respiratory infections experience pain when coughing or taking a deep breath. This can happen because the tissues around the lungs become irritated. But chest pain should never automatically be blamed on an infection. If chest pain is severe, crushing, pressure-like, or associated with sweating, nausea, fainting, or pain spreading to the arm, jaw, back, or shoulder, seek emergency medical attention. Warning sign number 6. Extreme fatigue. Warning sign number 6. Unusual fatigue. Fighting an infection can take a lot of energy. You may feel weak, exhausted, or unable to perform your normal daily activities. If fatigue is severe or accompanied by breathing problems, warning sign number 7 is one you should never ignore. Confusion or a blue or gray appearance around the lips or skin. These can be signs that the body is not getting enough oxygen or that someone is becoming seriously ill. Severe difficulty breathing, inability to stay awake, confusion, or blue or gray lips or face requires urgent medical attention. Who is at higher risk? Some people have a higher risk of developing serious complications from respiratory infections. This includes older adults, young children, people with chronic lung or heart conditions, people with weakened immune systems, and smokers. If you fall into a higher risk group, don't wait too long when respiratory symptoms become severe or unusual. Higher risk: older adults, chronic conditions, smokers, weakened immunity, viral versus bacterial. Now comes one of the biggest misconceptions about chest infections. Not all chest infections are bacterial. Viruses can cause bronchitis and other respiratory infections, while bacteria can cause some cases of pneumonia. Antibiotics work against certain bacteria. They do not treat viral infections. Taking antibiotics when they aren't needed can cause side effects and contributes to antibiotic resistance. That's why a healthcare professional should determine whether antibiotics are appropriate. How doctors diagnose it. So, how does a doctor know what's actually happening? They may listen to your lungs, check your oxygen level, measure your temperature, and ask about your symptoms and medical history. Depending on your condition, they may also recommend tests such as a chest X-ray or laboratory testing. The goal is to determine whether you have a mild respiratory infection, pneumonia. Treatment depends on the cause and severity. For many viral respiratory infections, treatment focuses on rest, adequate fluids, and managing symptoms. Some patients may benefit from medications recommended by their healthcare professional. If a bacterial infection is diagnosed and antibiotics are appropriate, your clinician may prescribe them. And if pneumonia is severe, hospital treatment may sometimes be necessary. Treat the cause, not just the cue. What you should not do. Here are 3 mistakes to avoid. First, don't take leftover antibiotics from a previous illness. Second, don't assume green mucus automatically means you need antibiotics. And third, don't ignore worsening breathing problems simply because you started with what seemed like a normal cold. 3 mistakes to avoid when to seek emergency care. Seek emergency medical care if you have severe difficulty breathing, blue or grey lips or face, new confusion, inability to stay awake, severe or persistent chest pain, or a rapid deterioration in your condition. When breathing is seriously affected, every minute can matter. Prevention? You can also reduce your risk. Wash your hands regularly. Avoid close contact with people who are actively sick when possible. Cover coughs and sneezes. Avoid smoking and secondhand smoke. And stay up to date with vaccines recommended for you by your healthcare professional, including respiratory vaccines when appropriate. Let's quickly recap. A chest infection can cause cough, mucus, fever, chills, fatigue, chest discomfort, and shortness of breath. But symptoms can overlap with other conditions, so you should never rely on symptoms alone to diagnose yourself. And if breathing becomes difficult, chest pain becomes severe, or you develop confusion or blue or grey lips, seek urgent medical attention. If this video helped you understand chest infections, share it with someone who might need this information. And subscribe for more evidence-based health explanations made simple.